or on YouTube, channel 𝗛𝗏𝗁 8:10 a.m. Radio Bandido.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗏 on 𝗛𝗏𝗁 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗏, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗏𝗁 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗏. I'm your host, Nicole Jacinto. Okay, today we are going to talk about heat-related illnesses. Yes. And we're here with Dr. 𝗛𝗶𝗶𝗏 Castillo. He's an emergency medicine specialist. Hi, Dr. Castillo. How are you today?
Hello, Nicole. I'm good. Despite the
Okay.
humid and
Yeah.
environment.
I mean, it's May in the Philippines, folks, for those of you who are abroad. And for the Filipinos who are working abroad to watch us. So, alam nyo naman na mainit kapag May, no, sa bansa natin. And anyone who's here and any foreigners who are watching, thank you for tuning in, by the way. When if you visit the Philippines in May, it's really, really hot. It's one of the hottest months, no? Traditionally, it's like April and May, end of March,
April,
May. And it's our summer here. Like, it's just hotter. Because it's hot and then hotter. And then even when it rains, it's just hot and raining. And but okay, so this is a very it's really good that we're discussing this in May to remind people. And I'd like to remind everyone to just share on your Facebook pages and everything. However you're tuned in, just share the show, because there's a lot to learn from it. And we are talking to doctors from 𝗏𝗏𝗵𝗏 who practice 𝗏𝗏𝗵𝗏, like Dr. 𝗛𝗏𝗶𝗏 Castillo. And the information that you get comes straight from the horse's mouth. Okay, so Dr. Castillo, let's jump into the topic now, heat-related illnesses. So, what are heat-related illnesses and how do they happen? Perhaps you can name a few that are the most common that people are experiencing, or that you even see in the ER, no, these days. Okay.
Yeah. So basically, heat-related illnesses, it's a spectrum of disease or conditions ranging from heat cramps, heat exhaustion, heat stress, and heat stroke. It's because of the exposure to abnormally high or continued exposure to abnormally high temperature. So, as you notice in news reports, you would see heat index is at 42, heat index is at 43, 45, etc. So when we say heat index, it's not actually the temperature in that area. Sometimes the temperature is quite low, but because of the humidity or the relative humidity in the area, therefore we have the so-called heat index. Or if you have your mobile phones with you, yung real feel or feels like, that's actually the heat index. No, so even though the temperature, let's say, is 37 or 30, the ambient temperature in an area is 37 or 38, but the relative humidity is 60-70%, then your heat index goes high as 42, 44. So it's because of that. Now, your next question: how does our body get affected with those exposures or with those illnesses? No, so our body has what we call thermoregulation mechanism. So in layman's term, the brain controls or signals our body that we are in too much heat or we are in too much cold. So it maintains our core body temperature between 36 to 38 degrees. So
Mm-hmm.
for our cells to function, for our heart, kidneys, and other organs to function, the core body temperature should be between 36 to 38. Prolonged
Mm-hmm.
exposure to more than 40 or less than 35, our thermoregulation mechanism starts to fail.
Mm-hmm.
So, as mentioned earlier, when you're exposed outside, and then you can maintain your core body temperature, but
Mm-hmm.
the environment
Mm-hmm.
adds up to that temperature, then
Yeah.
the patient will manifest symptoms, or manifest symptoms of heat related illnesses.
Thank you, doctor. So, I mean, I'm really glad you talked about the heat index. And nowadays, everyone can check on their mobile phones, as you said. And you explained the difference between the temperature in the area. Like, okay, it can say that the temperature is 38 or 39. But with the heat index, as you explained, when the relative humidity is higher, it gets worse. So I mean, can I ask you, like, if the humidity is higher, does the exposure to heat get worse, like automatically? Is that related?
The higher the relative humidity,
Okay.
somehow the heat index also goes up.
Yes.
So in the website of
Mm-hmm.
Pag-asa, for example, you'll see there a table
Mm-hmm.
comparing that if you have a temperature of, like you said, 37 or 38, but because the humidity in that area is high, so it feels like 39 or it feels like 40. Earlier today in here in Makati, no? So it feels that the temperature is 37, but it feels like 40. It's because of the humidity in the area. Something like
Thank you, doctor. And like what you said, we've been seeing for a few years now, feels like, and that's, you should pay attention to that because uh, you're talking about our bodies. Yes, we have our brains. Is the hypothalamus, is that involved in it as
yes,
well?
yes, yes.
Yeah, okay, so it helps us like control the whether our body temperature as mammals, right? So okay, um, just jump in anytime and correct me and my understanding of how the body works. So we can control it, but prolonged exposure can affect it. Our body starts. I
Mhm.
think you mentioned our body starts not really failing, but or getting affected if we're exposed to too much cold and we are not
Yeah.
like wearing jackets or things like that. I think people understand that part. But the heat also, we just say, it's so hot, it's so hot, it's so hot. But we also do not realize, because it's always hot in the Philippines, that it's getting too hot for us for our bodies to tolerate it in a way, and
Mhm.
our body starts getting too hot, as you said, when it's too hot, the environment plays a role. When it's too hot for our bodies, prolonged exposure, that's when we start experiencing symptoms of heat stroke. You mentioned heat stroke, heat stress, heat cramps, and I think, I'm not sure if you said dehydration, but that's part of it. So, doctor, knowing all this and having seen patients, I'm sure, for this many times, you might see me also. For this same kind of the spectrum of heat related illnesses that you said, that you mentioned. Who is the most, what part of the population is, or I guess a demographic, who is the most susceptible to these illnesses in those residing in the Philippines or visiting the Philippines? Like, what type of patient is that?
Okay. Unfortunately, the those people at risk are the extremes of age. No? So the elderly,
Mhm.
and the young children.
Okay.
Elderly, because most often than not, they have other comorbidities or other illnesses that can um, can can somehow does
Mhm.
not favor thermoregulation, as mentioned earlier. Yun nga, core body temperature between 36 to 38. No? So, young children, they don't know, or they don't speak up when it's too hot.
Yes.
They are just there, and then they'll have continued exposure.
Mhm.
Athletes are particularly a group of people who are at risk because they are, especially athletes who were not trained to do these, to have sports in under the sun.
Mhm.
So yeah, alcoholics, diabetics, obese individuals, because of their risk for dehydration and problems with autoregulation. So alcoholics, because when a patient is alcoholic, practically they are dehydrated to begin with. So exposing them further will expose them to further dehydration.
Mhm. Yes. Okay, so to explain this, if I mean, even if you're not an alcoholic, you go out now, you stay outside. Even if it's people will say, "Oh, we're doing it naman at night," but it's still hot. It doesn't matter if the sun is out, if the heat index is hot, as you
Yes.
said, and then you drink. I mean, you will get dehydrated. Alcohol dehydrates you. So if you don't drink enough water while you're drinking
Mm-hmm.
alcohol, and then of course if you're tipsy or you're feeling good because you're chatting with friends, you don't notice it right away, right, doctor? It's like almost like yeah,
And also if and also if you're drunk tonight and then you'll expose yourself tomorrow
yeah.
in the heat or under the sun,
Mhm.
and it doesn't mean tonight it's cooler than the afternoon, so I can drink tonight and then later on or tomorrow you'll be exposed. So it's the same effect.
Thank you for saying that, doctor, because I'm sure a lot of people don't realize it when they think that okay, tonight I'm okay. But if you get drunk tonight, I mean, and let's say, when you have a hangover, doctor, that is essentially dehydration, right? I mean, to begin with. So next day you have
Yes.
a hangover, then you're like, oh, I can still ignore it because I'm okay enough, and then let's go play basketball or something because we know Filipinos love to play basketball, and then or
Mhm.
you just get exposed to too much heat, bam, then you can get these illnesses. You can experience the symptoms of these illnesses, and then as you said, it's the elderly also because they have comorbidities that maybe could it be like some, well, not to get too much into it, but you did mention already like diabetes, and so even if you're younger, if you have diabetes type 1 and 2, no, I mean your body isn't regulating things as it normally would. So if you're part of the elderly population, you may have high blood pressure. Does that play into it? Um, or some maybe you're
Um, having
no doesn't. Oh, because
So
there's
having high blood pressure poses you, I mean, uncontrolled high blood pressure poses the person to have more risk to other illnesses. No? So not necessarily just because the patient or the person is hypertensive, then he is at risk for heat stroke. No, it's not. If the hypertension has complications, let's say kidney failure or kidney problem, then the patient does not or the person cannot actually regulate the electrolytes, then it has problems with dehydration. So it's the complications of hypertension, but not hypertension itself.
Thank you, doctor, for clearing that up because we'll often hear, ay, nandun ako sa init, na high blood ako, right? We do hear that, na high blood ako,
Mm,
or may high
yeah.
blood ka, wag kang lumabas. Pero if it's controlled, as you said, and you don't have other conditions, it's not a hard and fast rule that if you have hypertension or have high blood pressure, that you will automatically be um, at risk, more at risk than well, even a normal functioning healthy body can be at risk for these illnesses, right, doctor?
Yes, actually, even the let's say the middle age group, if you have, for example, hyperthyroidism or skin problems like scleroderma, you cannot actually dissipate heat, or you don't perspire a lot.
Mm-hmm.
So that's the one thing I forgot to mention earlier. No, so one of the physiologic response of our body is when we are in heat or when we are when the core body temperature is high. Our body's response is to perspire.
Yes.
So that it cool that the body is cooled down.
Mm-hmm.
So when you have problems first with autoregulation, or second you have problems with production of sweats,
Mm-hmm.
then you are also at risk. The person is also at risk for heat related illnesses.
Okay.
Although I for
Sure. Go ahead.
in hypertension, for example, sorry,
Well,
hypertension will not give, or will not actually, is directly proportional to heat, to the risk of heat related illness. But heat exposure can lead to increased blood pressure naman. So parang kaya siguro sinasabi
oh,
sometimes ng friends na, oh, high blood ka, you shouldn't go out at the heat of the sun. So
so
it's because you might have elevated blood pressure when you're exposed.
okay. Thank you, doctor. That is so informative and it clears up a lot of misconceptions. But okay, that's good. Sige, don't expose yourself to the heat, too much to the heat if you have if you have hypertension, as you said, because it can also elevate your blood pressure, which is not good for you. If it's controlled, man, it's not an automatic thing. It's not automatically related, but
Yes.
at least we know because we hear that often. Oh, wag kang lumabas dyan kasi high blood ka, ganun. Oh, so it can affect your high blood pressure, and make it, I mean, can affect your blood pressure and maybe make it higher. Doctor, let's talk about the symptoms, if we can, of these illnesses. What are the symptoms that happen? Because sometimes we fail to recognize it, no? But okay, what starts happening? You mentioned that when our bodies are in heat, that we perspire. Yeah, we
Mhm.
perspire. But see, if we don't have illnesses that have to do with not being able to perspire enough, or all of that, how can, like, let's say it's a healthy individual, even, perhaps any kind of specimen of humanity that you would like to discuss. What happens, what starts happening, what are the symptoms for, let's start with dehydration, and then the
Yeah.
rest of what you mentioned. Okay.
So when the person is dehydrated, the first thing, or the first noticeable thing, is he feels thirsty. So you
Thirsty.
have dry mouth or sticky saliva. No, so you'll have, eventually, because of the loss of electrolytes and the loss of water. So you feel fatigue, or you feel weak. You get easily irritated. No?
Oh.
Sometimes, if the sodium is too low,
Mm-hmm.
patients will have headache
Aha.
or
Okay.
lightheadedness. Okay. A good visual thing, or a good visual cue to know if you are dehydrated or not, is if the patient can urinate.
Oh, okay.
So yeah, so when you have adequate water intake, tendency is that you just pass it out through the urine. If you don't have adequate intake, meaning you have dehydration, then
Mm-hmm.
the body concentrates it, and then you produce a dark colored urine, for or a concentrated urine. No? So those subtle signs, or those subtle cues, will give you an idea that this patient might be dehydrated,
Mm-hmm.
or I mean,
Even
yeah,
yourself, no, you can tell, like, okay, I am getting a bit tired, I don't know why, I'm getting irritated, I'm getting a headache, and okay, so I'll go pee now. But parang you can't, or there's very little, then, oh, why is it darker than usual, and then I'm very thirsty, or I feel
mhm,
thirsty, or my saliva is sticky. Then those are the subtle signs, the start of knowing that you are dehydrated, or you're experiencing
mhm.
dehydration. And you did mention sodium earlier. So if you don't have enough sodium, you can get a headache. Of course, we hear.
A high normal, and more than normal, and low sodium can give people headache
Okay, I'd like
sometimes.
to I just go into that just a little bit, doctor, because we always hear, oh, don't take things with sodium, it's bad for you, and it's essentially salt, no? Salt has sodium chloride. So we hear stuff like, oh, don't take salt. And as you said, if you're sodium, of course you cannot tell at that moment, because you can't take a blood test of yourself and then send it to a lab and know
But
immediately. No, that's why we're talking about the symptoms. So it's also important, doctor, not to over sort of sodium itself is important also for our cells, because some people may be overdoing that. I want my sodium to get low. I want my sodium to get low. But if it's too low, just like when it's too high, as you said, it can affect you in that way, and you can it's a sign of dehydration, and it can give you a headache. That's one symptom. So when we talk about that, doctor, can we talk about water intake? Because ideally, what should a person, how many glasses of water or ounces or however you want to call it, how much should we drink of water in a day? And why water? Why not other drinks like energy drinks or soft drinks or sodas, or alcohol? Because
Okay,
the other liquids did.
let's
So let's
yeah,
explain it to everyone. How
yeah.
come?
Let's go first to the why not. Why not soda? Why not alcohol? So all these, as you said, they are all liquid. So they have water content in it.
Mhm.
So somehow it can replenish your water intake. However, in this energy drinks, in this soda or alcohol, there are a lot of electrolytes, sugar,
Mhm.
or even alcohol that some kumbaga, it contributes more to the dehydration rather than it helps. No?
Also
So
caffeine, doctor.
then let's go back to water.
Mhm.
Caffeine,
Also caffeine, doctor.
caffeine in the right amount is
Mhm.
good, but in excessive amounts, you'll still have other effects of caffeine such as palpitations, and
Mhm.
I mean, so you'll have increased heart rate. So when you have increased heart rate, it's your heart is overdoing a thing that the heart should supposed to do at 60 to 100 beats per minute. So if you're doing it excessively, then it generates heat. So may heat production. So it
Mhm.
contributes to the increase in core body temperature. It's not just the external environment. It's also what's
What's
inside
happening?
the person, that what's happening inside the person that can contribute to increase in the core body temperature. So example, you let's take for example the athlete who
Mhm.
under the heat of the sun. So aside from the heat index that he is experiencing, if he is not trained, then the heart rate goes up, the muscles
Mhm.
are overworked, so it causes or it brings in heat production as well.
Yes, thank you, doctor. Thank you.
So then let's go back to the question.
Yeah, okay. What's the ideal amount of water we should
So
drink? Thank you for
yeah,
explaining the why
for
not.
men it's
Why not.
about
Okay.
okay. So for water, for men it's about 3 to 3.7 liters a day. For women, up to 2.9 or almost 3. So just to give you a rough estimate, about 3, the 3 liters daily.
Okay. And when it's hot, does it change? Should we drink more? I mean, is that are we safe just drinking the amount that you mentioned? Like for men, did you say it's 3 liters,
3 to 3.7 liters.
and
Yes,
for women it's 2 liters to
2.9.
0.9? Okay. I should write that down. So I've been scribbling. Okay, two. Okay. So anyway, I'm like a student. I
Okay.
love it.
So So of course, when you have increased activities or
Mhm.
increased exposure, then you'll have your demand for water intake will also increase. So the 3 to 3.7 is in on a normal day.
Mhm.
When it increases when the temperature is or the weather is hotter than yesterday.
Because as you said, doctor, it's not just, I mean, whatever happens outside in the environment, it affects us, but it's also what's going on in our bodies. And if we move more or we're overdoing the exercise and our heart rate goes up, or we drink energy drinks that make our heart, or caffeine, no, they also have caffeine. They have caffeine, sugar, all these things.
Yeah.
It makes our heart rate go up too much. Um, it's what's going on, and we're not trained. It's what's going on in the body also. They're really like related. So 2 liters, wow, okay, of water a day ideally. Because we have the old standard of 5 to 8 glasses. But what kind of glasses are they?
Glasses.
We want to I mean, I want to explain also, right, doctor? Because what if they're
Yeah,
doing
yeah.
small glasses? Oh,
Approximately what? Yeah, one glass is approximately 200 to 250 ml of water or of liquid.
okay.
So if it's 8 glasses, that's 1.6 to math 1.8, almost 2
Yes,
liters.
yeah.
So
Okay.
yung old notion na 8
Yeah.
glasses a day actually is, if you compute it, it's not enough.
See, my mother was right. Mommy, you were right. Okay. So it's not enough. So it's better actually to think of liters and whatever size that is. I know most people in the Philippines related to the bigger soda bottles. I'm not going to mention names, but if we can sort of calculate that amount or have maybe sometimes they have these pictures or whatever it is or tumblers which give you an idea that okay, this is 2 liters or whatever, there's a measurement, then that can help a lot in calculating if you really want to or need to make sure that you are hydrated, and that's on a normal day, that's on a regular day. um does this is this also recommended for other, like if you're what if you live in a colder temperature, in a place that has a colder temperature, doctor? Is this the same? Is it like a standard worldwide, or we're focusing on how hot it usually is in the Philippines?
Uh, the 3 to 3.7, it's in general naman. So whether you are in a temperate climate or cool climate, no? So it's generally the same because your body, as mentioned earlier, can actually regulate that. No, so excessive amount of water, even though it's cold, you urinate a lot.
Yes,
So
yes.
on the other hand, you have just the right amount of water in a very hot environment. You conserve it. The patient won't urinate,
Yeah.
so it stays within the cells of the body.
Okay. Doctor, I just want to mention also that a lot of people, it's summer now in the Philippines. It's May. It is very hot. I stepped outside before the show to get the feel of it, and I was like, I should go back inside. I mean, and drink more water. Um, you know, it's when you go around, sometimes you bring a bottle of water, and sometimes you don't. Like if you're very busy, even if you're not exercising. So I want to remind sorry, you're not yet a patient, but people out there, like if you go around a lot, you're very busy, you're doing errands that you have to do, you're at work, and you don't drink enough water. There's also one thing, people don't want to pee when they're outside. Maybe that's because the bathrooms here are not or there's a lack of whatever public bath.
Sanitary.
Yes. Thank you for that. Okay. So also like you don't want to be bothered to pee because I am going to go into my car and then I'll be in traffic for 2 hours. So I don't want to have to pee at that point. So I mean, maybe you can remind them, doctor, that they, or I guess I'll remind them na lang that you still have to somehow manage your water intake, because yes, you don't want to be, you're very busy, but it we need it, right? So there has to be like, okay, a bathroom stop in some place, like maybe you can, I don't know, we used to do this before, that bathroom is not so bad, and then you stop and all of that. Do you know many, have you seen many patients who like they didn't drink water because they didn't want to pee and then they ended up in the ER? Just out of curiosity.
Well, the more common connotation is they're having urinary problems. No?
Okay.
So they might have urinary urinary tract infection because they controlled their urination, so or
Yes.
they held their urination. So it's quite common, but I cannot correlate it like it's
Okay.
because of that. No,
Thank
so
you, doctor.
mhm.
Yeah, just out of, curiosity and just reminding people out there, somehow we have to manage it. Doctor, why is the amount of water for females and males different? Why do females need less water? And why do males need
Okay.
more? Okay.
Okay. Again, this is in general population. No? So nowadays we see a lot of women who are athletes. A lot of so in the general population, females are usually not the athletic type. Please
Yes.
don't quote me on this,
Oh,
but it's
we
I
understand.
mean, yeah, yeah, it's in the general population. So when females have what do you call this, have smaller body habitus than the males, so there's a lot more, there are more requirements for males rather than the females when it comes to water intake. But then again, if you know that, for example, you are a female and you are very athletic and you have lots of activities in a day, no one is stopping you to for consuming more than the 2 or 2.7 limit. It's not actually a limit. It's more of a recommendation.
Recommendation on, like, this is a recommendation for the minimum for you to
Mm.
stay healthy. It's more of a minimum, not a limit, but
Yes.
it's a guide so that you don't overdo it. I want to talk about that, doctor. Are there people who should not drink a lot of water, and what are the dangers also of drinking too much? Because what if somebody says, oh, okay, I'm gonna do it, and then I'm gonna drink 5 liters today?
Mhm.
Are there
Okay.
also, yeah.
So generally, those people with kidney disease who cannot actually urinate or filtrate their water intake, it's advised that their water intake is lower. So usually two liters,
Mm-hmm.
less than two, or less than 2.1 liters a day, yung
Mm-hmm.
limit nila. Other patients such as those with heart failure, so
Mm-hmm.
they tend the water or the fluids tend to accumulate. So they if a patient has heart failure, the heart does not pump normally, no, so it
Mm-hmm.
cannot give or distribute these liquids to the different parts of the body, such as the kidney. So those with heart failure, those with kidney problems, generally they have limited they should limit their water intake.
Thank you, doctor. At least we cleared that up for people. And of course, if you have kidney problems and heart problems, check with your doctor, right? I mean, to see like how much your doctor recommends, what the amount of water, and also, doctor, I do remember an incident before where it was in the U.S. actually. There was a woman who ran the Boston Marathon, and the Boston Marathon is I mean, it's really quite a prestigious and big deal, no, and it's I wanted to run it, but of course I didn't. Okay, so anyway, she drank too much water apparently because she was hydrating herself, and then she actually died. So watch it also, like, make sure that you talk to your doctor. Like, she just wanted to get across the finish line, and she drank too much water. She overhydrated herself. But we are talking about dehydration now. I just wanted to mention the opposite, go the opposite way, so that there's more info out there that, okay, don't overdo it. Like, even if you're not a kidney patient or you have heart failure, because as you said, when you have heart failure, your heart doesn't pump normally, and maybe too much fluid also is bad, no, for you if you're putting it in your own body. So I think maybe her sodium went down, something like that. Okay, let's not get into it right now. But that was an example that I just wanted to cite, because even if you're healthy and you're an athlete, and you could overdo it. So I just want to make sure that people are very informed by you and this show about the spectrum of not overdoing it, not underdoing it. And then, doctor, when it comes to dehydration, let's say you're dehydrated, can it lead to other, like, more serious illnesses? Let's say you're just like, I'm dehydrated. Okay, then you figured out, or someone else figured out you're dehydrated. If you keep getting dehydrated, or let's say you have
Yeah.
one incident where you are exposed too much to the heat and you are dehydrated, can it lead to other illnesses, even the ones you mentioned?
Yes. When a patient has very low sodium, for example,
Mhm.
patients could go into seizures
Mhm.
or convulsions. Sometimes they go into coma because of that. And then there's a very delicate way of correcting those things, but maybe later on we can discuss it.
Okay.
But potassium, for example, so too
Mhm.
much or too low potassium can can result to cardiac problems, or
Yes.
problems with the rhythm, or what we call arrhythmia. Um, and then other manifestations of
Mhm.
um, heat loss, or heat problems would be vomiting,
Mm.
nausea, coma, or loss of consciousness. That's
Wow.
why people will say, please don't go out, you might have heat stroke. So the connotation of the stroke itself, like the unilateral or one-sided weakness, it's not found in heat stroke. It's usually loss of consciousness, or dizziness, or um, other manifestations of neurologic problem, rather than one-sided weakness
Yes.
or one-sided manifestation.
So a stroke, which is a stroke, there's a you can get a stroke that's different. When we talk about heat stroke, it's not the same stroke that happens to people where you get a stroke. There is either too much bleeding in your there's a brain bleed, or there's a clot, and then one of the most common things that we see, like the consequences of that, is like you can't really move one side, no, afterwards, and then you have to do therapy or whatever if you're treated. But it's the manifestation of heat stroke is loss of consciousness, as you said, and other things going on in your body, vomiting. Well, about vomiting, doctor, and nausea, like nausea, you want to throw up, right? And vomiting, about vomiting, doctor, because you see, when somebody is experiencing these symptoms already, it's very common for people to say, drink this water. But some times the person or the patient is throwing up and can't retain the water. So should you force someone to drink water? I mean, they're vomiting. Okay.
Yeah. So you mentioned it right, no? So some people, when they saw when they saw a person throwing up, then they force in water, or you drink this, you drink this. It's basically the same. The patient cannot actually
Mhm.
tolerate something on his mouth.
Yeah.
So sorry, is it the connection?
Um. mm, Okay.
Anyway,
Yes. The person can tolerate
all right. So
mouth.
you don't,
Yeah. So.
yeah, so you don't force it until he or the person can actually tolerate it
Mhm.
already. But if this persists, like if the patient cannot tolerate anything placed on his mouth, like water, or ice, or things like that, then this patient needs to be hydrated through intravenously, so that now becomes a signal for you to go into the nearest hospital if the patient is persistently vomiting.
Yes, because I mean, it can't. I mean, if you force them to drink, they cannot. Suka lang ng suka. I mean,
Mhm. He
that
might the, and then might end up having other complications such as aspiration pneumonia or things like that, no? So instead of you helping the person, you actually aggravated the situation.
by
No,
force.
you by forcefully having the person to drink something, no? So
Yes. So better, that's a sign, take the person to the hospital already. Go to
mhm,
Dr. Castillo or anyone in the ER of Makati Med. If they cannot tolerate anything, they're vomiting too much because their electrolytes will be off and they're going to be in so much pain. And okay, so doctor, how do we in terms of so we've talked about the symptoms and the amount of water, the recommended amount of water. You've talked about dehydration and heat stroke. Is there, what else do you want to discuss in terms of like how can we tell when the patient should already be brought to the ER? Because that happens often, I guess, that it's a little too late, or it's better to bring them already. What at what point can we, can people who are with the patient, or the patient herself or himself, realize that, okay, I better go, better get someone to take me, or
yeah.
mhm.
Yeah. So we mentioned one, if the patient or the person is persistently vomiting, so he cannot tolerate anything by mouth. Next
Mhm.
is if a person lost consciousness,
Mhm.
or patient fainted, or sorry, the person fainted, the person had seizures or convulsions. Um,
Mhm.
so if you cannot regain if the person cannot regain consciousness, then all these things, or all these manifestations, they happen very fast. So
Mhm.
you should rush those and with the notion that the patient has been exposed to heat for so long. So the top diagnosis in mind, or the top condition in mind, is actually heat stroke or heat exhaustion. So these patients, or this should be brought to the hospital as soon as possible.
So, doctor, heat stroke is really a medical emergency. Because people might take it for granted. Na heat stroke siguro yan, tas okay lang yan.
Mm.
Uminom lang ng tubig or hayaan mo matulog. That we often hear that.
Some sometimes what people manifest, or what people experience, is just heat exhaustion.
Yeah.
But heat exhaustion, with prolonged exposure, that heat exhaustion can suddenly turn into a heat stroke. So you cannot actually distinguish, exhaustion lang yan, wag nating, okay lang yan, okay na siya. But when a patient, or when a person loses consciousness, that's the first manifestation that this patient might be suffering from heat stroke.
Stroke,
So,
okay.
but if yes, but if the person just feels fatigued
Mhm.
or thirsty or feels like dehydrated, it might be heat exhaustion. The delineating factor is the consciousness of the patient. If the patient fainted or lost consciousness, then it's the manifestation that it's heat stroke and not just heat exhaustion.
So how fast can it happen, doctor? Okay, let's say someone's having heat exhaustion, no? And it can become heat stroke even if okay, maybe we can talk quickly about like what should you do? You feel like you have heat exhaustion. What
Mhm.
are the things you should do first? Because of course everyone will try to like, okay, let's put the person in an air conditioned room. I mean, what are the things that the person that you should do to someone who's, let's say, vomiting, or having, you think,
Mhm.
or there's manifestation of dehydration and heat exhaustion? Maybe we can go there first and then go to the point where I they lost consciousness, now it's heat stroke. Like what should be
Yeah.
done? As we
So
said, we force water, right? If there's vomiting, okay.
mhm. So for me to During my med school days, I always package things so that I can remember. So this one, I package them to CRC. C
CRC.
is call for help.
Okay.
Okay. Whenever you feel that this patient might be having heat exhaustion or heat stroke, you always call for help.
Mm-hmm.
Second is remove the patient from the hot environment.
Yes.
So to prevent further exposure or continued exposure. And last is C, cool the patient.
Will the
So
patient.
that's the things like you can spray mist or water, you can provide airflow, you can ventilate the patient, you can place damp or cool cloths um, on the body of the patient. No, so place ice on the patient. Those things to cool down the temperature. Those are the things that you can do while provided that you have already called for help and remove the patient from the environment.
Because if you keep them there, mainit pa rin. It's still hot. So call for
Mhm.
help and then let's say bring them into a cooler room or out of that place. Diba? You might be exposed to the sun. You might be in the beach or something as many people do during summer. And then the um the cool the patient, you can put ice or sometimes people put towels wet in cold water. And should we put, what area should we generally put it on? Is it the nape? I'm under the impression that I don't know why that we should put it on the, like, the nape, and then maybe the face. Or what can you tell us, doctor, what areas should you put cold things on? I mean, the ice and all that to
Okay.
cool down the patient properly.
Usually the armpits,
Okay. Yes.
inguinal area. So those will slower down or make the core body temperature cool down faster. So parang mas gitna or mas core, that would be better.
Okay. And that's why also, no, doctor, when we check for fever, it's the armpits, like, I mean, traditionally you put the thermometer there. So those areas
Thermometer. Mhm.
can really, if you put the cold there, even if it's like, we that's a good place to put it to cool the patient down. But you did stress that your CRC is call for help and then remove the patient from the heat or the area, and then C is cool the patient down. So when you call for help, doctor, I guess that's calling a professional or maybe asking someone already to help bring the patient to the emergency room, right? Or get some kind of um, I guess a medical opinion from a doctor, and not just sort of take it for granted. Because let's go back to, like, when a patient, you're saying a patient can have heat exhaustion, so you're doing all these things already, but you called for help because you told the others, hey, so and so is not feeling well, let's try to give them water. Oh, they're vomiting. A lot of people say, okay, the person calmed down and fell asleep. How can we tell if somebody just fainted? Sometimes kasi, okay, natulog siya, okay na yan. Pero paano kung nahimatay siya? 'Di ba? Like some guidance there. What if nahimatay pala siya, hindi siya natulog?
Yeah. In that situation, actually, the first thing that you should bear in mind that a normal person won't sleep under. I mean, just for example, just after having heat exhaustion or heat stroke, the normal person will not sleep just because he wants to sleep. No, so
Yeah.
there is a problem there. It's actually
Mhm.
fainting. It's actually a medical emergency. So parang don't misconstrue it na gusto niya lang matulog or nakapagpahinga na siya, no?
Wow.
So yeah, you look for the extremes na in this situation, under the sun, who will sleep after after experiencing heat exhaustion. It's actually fainting or loss of consciousness. Then that person must be brought to the hospital. Calling for
Yeah.
help is not limited to calling for
Mhm.
professional or medical help. As simple as carrying person from the heated environment or from the point of accident, for example, or the
Yes.
hot environment can help or can help save the patient as well.
Mhm. Okay. Doctor, what tips can you share so that we can, because our time is running out. What tips can you share for us to help prevent heat exhaustion, heat stroke, dehydration, all of these things, especially
Yeah.
now with the heat? Mm.
So first, wear sunscreen. It helps on preserving I mean, dissipating or reflecting back the heat and the UV rays.
Okay.
Hydrate either with water or with those electrolyte drinks
Oh.
whenever you're out on the sun, especially if you are an athlete or if you are going to have outdoor activities.
Mm-hmm.
Wear light clothing. As you know from Science 101, dark colored objects absorbs light or and therefore absorbs heat more. So
That's why I
wearing
wore
light,
for the topic. Yeah.
yeah, and then as much as possible, you limit your activities indoors. Please don't go outdoors at the peak of sun exposure, like it's between 10 a.m. to 4 p.m. So if you have activities that's outdoor, limit it to 7 to 10, and then 10 to 4, you go indoors, and then you go outdoors again after 4 or after 5.
Mm-hmm. Thank you, doctor. And then anything else that you'd like to take up and say? Let's go for it, doctor. Just go for it, Dr. Castillo. Anything on the topic. Just, you know, put it out there. And then, of course,
Yeah.
I you my
So
with.
anything in excess is bad.
Mhm.
So excess sun exposure, excess heat exposure is bad. But it does not limit you to have outdoor activities, especially this summer. So just bear in mind that those things, these environmental illnesses, should not limit us in our activities. But bear in mind that everything in excess is that bad for your health.
Yes, thank you, doctor, for reminding us of that. Let's even if okay, you say you're not gonna. I mean, you need to exercise, but you have to remember it's summer. Right? I mean, you want that great body, but you might end up in the hospital if you force it, right? And
Mhm.
as you said, anything in excess, it could be drinking for people who drink, exercising. I think that's a big thing, doctor. Some people maybe should be reminded because, you know, summer you can go outdoors and then you can exercise, or even going to a gym that has no air conditioner in it, and or being in crowded places, body heat. I mean,
Mhm.
there's it's
So
hotter when. Mhm.
you've already mentioned dehydration because of the heat illness itself, and then vigorous exercise. This also contributes when not balanced enough. This contributes to other complications such as rhabdomyolysis or kidney failure. No, so but just to give you a some sort of extreme, na there's heat, there's excessive exercise, or there's intense exercise. Add them together is has more complications.
Mhm. Yes. Thank you, doctor. Because I know a lot of people who exercise, and I also know a lot of people who don't. But it's in the heat right now. Like sometimes to be like, "Are you sure your gym is air conditioned?" Or somebody will say, oh, "Okay, we're going to the beach. All right, keep hydrated." I'm like, the nagger. Sorry, I
Mhm.
end up playing that role. Friends, sorry about that. Or did you drink enough water? And then they're like, did you drink enough water? I'm like, no, I didn't. It's it's a back and forth thing. But yeah, anything in excess. I mean, even at night, doctor, no, the heat is still there. And thank you for telling us about sunscreen. I mean, reminding us because it reflects the heat back pala. So that's one good thing. And if you're, how about excessive sweating, doctor? Because it's hot. Is that I just wanted, like, at what point is perspiration when you perspire? At what point is it, sorry, I just wanted to ask that, I forgot earlier. At what point is it, hey, this is too much. This person might already be having heat exhaustion. Diba? Eh,
Okay, so that's the normal physiologic response of the body is to perspire. No? So the problem is with repeated exposure or repeated continued heat, the patient does not perspire. So that's the more problem than having excessive perspiration.
Okay, thank you, doctor, for clearing that up. And also, because, like, what if someone is, in the heat exposed to it and they're perspiring, and then at one point they stop perspiring, but that doesn't mean na, okay na siya. Hindi na siya, how do you say it again? Hindi na siya hindi na
Wala
pinapawisan.
nang problema.
Oo, wala nang
Hindi na
problema kasi
pinapawisan niya.
tumigil na yung pawis niya. No, no. Better still be careful and err on the side of caution. Is there anything else you'd like to say or any advice to people that you have, doctor, to possible patients or just, people out there about heat-related illnesses, especially now that it's May, and especially now that, I mean, you are an ER doctor and you must see a lot of this. And I was wondering if you're seeing a lot of it now, a lot of cases coming in.
I think most of the people already know how to cool down themselves. No, they know how to control exposure. No? So I'll just borrow one song or album from a singer in this cruel summer. From Taylor.
Taylor
Sabi ni
Swift.
Taylor Swift, sabi niya, in this cruel summer, you need to calm down. So binago ko lang siya, in this cruel summer, you need to cool down. So I think that will summarize somehow everything that we've discussed so far.
Thank you, doctor. So, borrowing from Taylor Swift, thanks, Taylor Swift. I like her. What do you call this? What was that? Say it again, doctor. In this cruel summer.
Cruel summer, you need to cool down.
Cool down. Okay. Thank you. I'm sure a lot of people will remember that. So thank you, doctor. Would you like to say hi to anyone before we go?
Hi to the friends from emergency department and patient health medical records of Makati Med.
Hello also to you, and I hope I don't see you. I mean, for an emergency, I could visit and hang out, but not for an emergency. And doctor, I'd like to thank you. We spoke like a week ago, and I can speak to you anytime. Thank you very much, and I'd like to say hello also to Tata, who's watching now. Tata, get well soon, and we all love you. And thank you very much, Dr. Castillo. And hello to Micaela also, Mark, and Nikki. Okay, so that's it for today, folks. Student Healthline with Makati Med again next week. And I am wearing white because I was following the advice Dr. Castillo gave me quite some time ago. It may have been last year. Wear lighter colors. They don't absorb as much heat. Thank you so much for being on the program today, for taking the
Nicole. Thank you.
And making the effort. Okay, so that's it for today, folks. Tune in again next week to Healthline with Makati Med. We'll have more information for you, and we'll have more doctors from Makati Med, one of the most prestigious hospitals in the Philippines, and you'll hear advice and information straight from the horse's mouth. Thank you so much. Okay, guess that's it for today. Bye, folks. See you next week.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.